Welcome guys to Dr. Saddam Kenya, and in today's video I'm gonna give you a brief explanation of what you should expect after using Misoprostol and Mifepristone in the process of you getting your abortion. So if you're new to this channel, kindly hit the subscribe button, enable the notification bell, and if you have any questions, kindly leave them in the comment section, or you can reach me out through my WhatsApp number. The most common procedure of you having this abortion using these drugs is usually the first thing you get the medication, and the medication would look something like this. It's usually 5 tablets. The first tablet is usually Mifepristone. The 4 tablets below are usually Misoprostol. Now what you're supposed to do is on the first day you're supposed to take the first tablet, which is Mifepristone, then wait for 48 hours before taking the other 4 tablets, which you just place under your tongue. Now what you expect to see is the following. Now on the first day after taking the Mifepristone tablet, you are expected to see some slight bleeding in some women. Now in most cases you'll likely not see anything, but in some cases you might have some light bleeding, you might have some light nausea and some few other things, but there is usually nothing much that happens between the first and the second day. Now immediately or after the second day, immediately after you taking the 4 tablets and placing under your tongue and waiting for them to melt or etc., then swallowing the rest, what you're expected to see is that within the first hour or even earlier, you'll start having painful cramps, and immediately after that, what is going to follow is that you're going to have some sort of bleeding, and this bleeding is usually slightly higher than the normal periods that you usually experience, and after that, you'd probably get to a point in which you'd have some sort of clotting and some discharge in addition with the bleeding that will be coming out together. Now, immediately after that, the bleeding should start to reduce after some time, and you might as well start experiencing some other symptoms, including nausea, vomiting. For some people, diarrhea might follow, and you might also have a slight fever during the whole process. Now, this whole thing is usually happens within a matter of 4 to 5 hours, and after that, the bleeding should subside or reduce drastically or completely. And in most cases, in some women, the bleeding can continue. Light bleeding can actually continue for a matter of days, maybe 5 or even a week in some women. Now, one important thing you need to keep in mind is that immediately you start having the bleeding, or immediately the bleeding has started happening, you need to go to hospital, because at the hospital, in case you develop any complications, you might be given some medications that might be able to rescue your life in the whole process, because at the end of the day, abortion processes is a medical procedure, and some complications can arise during the process. In addition to that, at the hospital, you'll be given some antibiotics to prevent you or to protect you from developing any form of infection. So if at all you've used any of these medication, misoclear or Mifepristone or whatever, and you've not seen something like this, the symptoms that I've just mentioned, you've not had any bleeding, you just had a light bleeding and that was it, then there's a very high likelihood that your pregnancy is still intact, and that it is very important you go to your hospital, your doctor, they check on you and ensure that if you want to keep the pregnancy is safe as well. Thank you guys for watching this video. Kindly hit the subscribe button.